Great. I think we can get started. Good morning and welcome, everyone. My name is Susan Rogers Van Katwyk, and I'm the Managing Director of the AMR Policy Accelerator at the Global Strategy Lab. And I'm delighted to welcome everybody to our webinar this morning on antimicrobial resistance and the Sustainable Development Goals. This week, world leaders are meeting in New York to review the implementation of the 17 Sustainable Development Goals, which aim to promote collaboration between people around the world to end poverty, improve health and education, reduce inequality, spur economic growth, and also tackle climate change alongside all of that. But what has become, I think, very clear since the goals were adopted in 2015 is that we cannot tackle these kinds of challenges without also considering the impact of antimicrobial resistance, which touches many deeply entrenched social and economic issues that go far beyond individual human health. And so to speak on this subject today, I am joined by three really excellent panelists, and we're delighted to have them. We have Anand Balachandran from the World Health Organization. Anand is the unit head for national action plans and monitoring within the AMR Division at the World Health Organization. And Anand has worked with WHO for more than 20 years and has experience in the areas of hunger relief and conflict management. And he also has expertise in strategic planning, implementing complex multi-stakeholder projects, managing global partnerships, and leading global political advocacy initiatives as well. So welcome, Anand. Joining us from ICARS is Dr. Sujith Chandy, who is the Executive Director at the International Center for Antimicrobial Resistance Solutions. And prior to this role, was Senior Professor in the Department of Pharmacology and Clinical Pharmacology at the Christian Medical College in Vellore, India, as well as being the Director of the REACT Asia Pacific organization. Dr. Chandy is a resource person at many international forums and is a member of the World Health Organization Strategic and Technical Advisory Group on AMR as well. And then finally, Dr. Viviana Muñoz Tellez is the program coordinator of the Health, Intellectual Property and Biodiversity Programme of the South Center, which is an intergovernmental think tank of 55 developing countries. As of 2006, Dr. Muñoz leads the HIPB team, providing policy-oriented research, expert-driven advice, and technical assistance activities to developing countries, and runs various projects on AMR as well. So I am very delighted to welcome all three of our panelists today. I invite everybody who's joining us online today to introduce themselves in the chat so that we know who's in the virtual room. And I'm going to kick off today's panel with a number of questions for our panelists, but towards the end of the webinar, we will also open it up for questions from the room. So please add your questions to the Q&A box as we go, and then I'll put them to the panelists at the end of the event. I want to start today with just an opening question for all of our panelists. And I want to ask you all, in your work, what do you see as the most concerning impact of AMR on the Sustainable Development Goals and global development more generally? And I think I'll put this question to Viviana first. Go ahead.
Thank you, Susan. As you mentioned, I work in an organization of developing countries. So the first thing I would say is we see that the AMR challenges are very much intertwined with development challenges, and AMR is a development challenge in itself. So when we look at the SDGs, they're clearly off track. The fact that we have not been able to end hunger, we have increased poverty arising after the COVID-19 pandemic, with 93 million additional people in poverty, totaling up to 430 million. We have rising inequalities, both in between countries and within countries. And so when we look at AMR, AMR is really a threat to widen all these existing inequities and vulnerabilities that we have in developing countries already. And this also makes the attainment of the SDG goals more difficult. We're likely to see more crises such as COVID-19 in the future. And so AMR will make the response to such crisis even more complex, especially in developing countries. In the context of developing countries, it's really important to note that there is really a double burden that it's very concerning. We have a lack of access to life-saving antibiotics, and we see that critical lack of access affecting already livelihoods and deaths in youth and children. And at the same time, we also have the burden of rising antimicrobial resistance, which is a burden that is in particular heavy in developing countries compared to the data we've seen so far. So I think that is what I'd like to start with, is just really saying AMR is a development challenge in itself.
Thank you. I'll go to Sujith next. Same question to you.
Thank you, Susan, and thank you to the AMR Policy Accelerator for inviting me. I think when you ask that question, what comes to my mind is a building which is getting old and it needs to be repaired due to constant forces, both internal and external. And actually, it's affecting the people living inside that building in different ways. So now for a moment, think of the world as this building, with issues such as climate, food, and water issues all being the external forces of threat. But then there are also internal threats to us, living beings, such as AMR, the microbial world, disease, and so on. So to me, these are threats to our planetary health and the health of living beings, which, in my opinion, needs a scaffolding on the outside and multiple inside jobs for those living in that building. AMR, I think, is just maybe one of these threats, but it's so critical at this point of time that we do something. But due to that interface with One Health, it makes it an existential threat to the planet and us as living beings. So just to summarize, SDGs, in my opinion, are the tools for global development and provide that crucial framework of support and action to contain the threat of AMR and other such threats. I believe it's a pathway that must be imbibed into our very being and thereby improve our planetary health as well as our own health. Thank you.
Thank you. That's a great analogy. I like that a lot. Anand, over to you next.
Yeah. So I fully endorse what Viviana and Sujith have said, because for me, working within WHO, people would assume that human health would be the main area that we are concerned about. But frankly, for me, the biggest impact would be on poverty. And really extreme poverty, and there is enough and more evidence. When people are pushed into poverty, it impacts various other elements of food and nutrition, water and sanitation. Of course, access to medicines and out-of-pocket expenditures, and inequities are further heightened, et cetera, et cetera. So for me, addressing AMR is a very, very critical development challenge. And for me, the SDG goal number 1 on eradicating extreme poverty or zero poverty or no poverty is for me the driving sort of a goal. Of course, when you're trying to do that, and if you try to do that, you will have better outcomes in health, in human health. So and some other areas, I think Viviana really highlighted the point about inequities, and that also in my unit, that is one of our core principles. In fact, in our new work plan, we have always said leave no behind is our guiding principle for my unit. So it's much more than health. It really is a development challenge. And if I keep looking at the 17 goals and AMR impacting, I think I can find a link between AMR and almost all of these 17 goals. Yeah. So I'll stop here. I fully endorse what Viviana and Sujith have laid out.
Thank you, Anand. I fully agree. It's definitely possible to draw a link between AMR and all of the other 17 goals. Sujith, keeping that in mind, 17 different goals that AMR is connected to, what would you say are the really important SDGs to consider when we're trying to plan AMR containment strategies?
Yeah, I think, interestingly, my answer is all 17. since actually, if you look at it, there's a bidirectional connection between AMR and most of the SDGs. But I guess it depends on how you look at it. In my opinion, the ones which are in one way directly related are 3, 6, 9, and 12. You have 3, which is good health and well-being. And you have, the improvement of health and prevent infectious disease and thereby reduce antibiotic use. And of course, public and global health with emphasis on prevention is key in that. Then you have 6 with clean water and sanitation, hygiene, IPC, waste policy, implementation, and all can prevent more infection and antibiotic use. And then you have 9, which is industry, innovation, and infrastructure. Here, of course, the investment needed for innovations in the AMR space, especially as an alternative to antimicrobials and diagnostics, is key. And then lastly, you have 12, responsible consumption and production. Access and excess issues, of course, come into play, but also the pharmaceutical chain, waste disposable. They all need to be refined, standardized, and optimized. But let me just very briefly also say that the other related ones, number 1, no poverty. Number 2, zero hunger. Because both of these depend on livelihood, food security, and AMR can impact both. Even education, just imagine if people had better health education, what would the world be? SDG 5 with gender, we all know that pelvic inflammatory disease, infections, UTIs, these are all issues, but the decision-making in households and economic parity is an issue. And then last but not the least, of course, 10, inequality of resources and economics, they all lead to health issues in how it's managed. And with this migration in 11 into lands and cities, the increased risk of infections. And then, of course, the last few are all about environment, and we all know the One Health issues there. But let me stress on the last one, 17, partnerships. Bacteria and microorganisms are very good with partnerships and communications. We are doing it as humans, but I'm not sure whether we are matching up to them in terms of speed and collaborative capacity, especially with One Health sectors between the regions of the world and in competition with other priorities. Thank you.
Thank you so much for that. And then in terms of partnerships, I know in the work that you're doing at WHO, you hear from a lot of different countries about the challenges that they're grappling with. What are you hearing from them about the main critical challenges that countries are facing in terms of fighting AMR as it links to the Sustainable Development Goals?
Right. Now, this is a very, very critical question. First, we should recognize that 170 countries have taken AMR seriously and have developed AMR national action plans that are multi-sectoral, that involve various sectors. So I think first, kudos to countries for taking at least that step, establishing a national action plan to address AMR. But when we did a polling of about 120 countries, there were 3 critical challenges that popped out. The very first one was multi-sectoral coordination. And so this is very much aligned with Sujith's point about, number 17, SDG goal about number. So there is a real challenge, and governments are not structured in a way to address this problem in a One Health fashion. It is still various sectors, trying to work on this problem, but we are seeing that there is significant challenges not only in low and middle income countries. I can even name a few G7 countries who are facing this challenge of coordination between Environment Ministry, Agricultural Ministry, and Health Ministry, Water, Sanitation, etc. They're not sharing data. They are unwilling to share data within themselves, even surveillance data. So how do you expect them to share data globally or regionally so that we get an understanding of the global burden of AMR? So the first point is multi-sectoral coordination. Saying One Health is a very simple and easy and catchy slogan, but in a vast majority of countries I have dealt with, it remains a slogan. Implementing it is very hard. The second point I want to make is that most countries, their very second challenge is financing for AMR. Only 10% of the countries have allocated any financing in their national budgets to address AMR. they are not thinking of addressing AMR the way Sujith just highlighted. All the 17 goals can have an impact on AMR, and AMR can have an impact on those goals. So the interdependency is really not understood in most of these national action plans. It's still very much a silo. And they're unable to explain to the ministers of finance how and who is going to manage these budgets, because there is no one health ministry. And coordination, like I said, is a real challenge. So they find it very hard to find resources to address the problem in a sustainable way. And of course, the third one is technical capacity. In most countries, there is significant gaps in technical capacity and understanding about the problem. And they keep telling us, please, explain AMR in a way that our policymakers would understand. Can you put a face and a voice to the problem? Don't talk to us about pathogens or medicines. All that is fine, but to get the attention of policymakers, you need a face and a voice, or to put it in this context of lives, livelihoods, and impact on the environment. So those are the three big challenges, I would say.
Thanks, Anand. Yes, communicating about AMR has consistently been a challenge, and communicating about a One Health challenge is really difficult as well. And I think that oftentimes it means that we can't so easily look just to the health sector for examples that we can use as roadmaps for the future. So Viviana, I'm wondering, are there positive examples that you're seeing from other policy arenas, things like climate change or coordination in other sectors, that we should be looking at when we're looking for new strategies to address AMR and to make progress on the SDGs as well?
Yeah, I mean, that's a big question. As was noted before, there's a number of AMR, either direct interventions or AMR sensitive interventions that can be made. So when we compare with what has been good practice, let's say from other areas, I think one thing is on AMR, we focus a lot on building national action plans, which is quite positive to at least get the attention, of government and different ministries together. But that at the same time, that towards then disseminating in society, it's not very clear. What does it mean that we have this national action plan and list of activities? And then when we look towards implementation, which Anand mentioned very well, we see that it's not clear how that trickles down. So in terms of information and communication, that's a big issue we can draw from other movements. For example, on HIV/AIDS and on climate change, advocacy is really key. And how do we drive those message home beyond the expert audience? So awareness raising and bringing evidence from the ground to actually inform and give those examples and those faces that, as Anand was saying, that would really help to explain what is the issue, what is the problem. And I think there we can draw from other movements to say that advocates from civil society and really on the ground communities is really key. And we need more of that on AMR. So that has been increasing. I think for us as South Center, that is one a big area that we like to see increase. And I know, for example, Sujith here, coming from REACT, knows that's been so important in helping drive the AMR agenda. But in addition to the awareness raising, I think the other real important opportunities for more engagement from communities on the ground and from civil society is also increasing the accountability, both from government, but also, for example, from private sector actors about what they're doing on the AMR actions. So that's really dissecting in a more clear way what is the content of national action plans, what have been actual achievements, what is the data, because it's very hard also to know some reporting back, even with the help, for example, of WHO in developing the sort of accountability framework and monitoring evaluation from national action plans. But there we also have to think is, how do we create also positive incentives for countries to increase their reporting and providing data? So many countries do have more data than they are reporting, and they're more willing to provide in in a way that they don't feel that they're actually going to get more sticks and less carrots from providing that data that they have, for example, in terms of surveillance and so forth. So just another last point in terms of what we can draw from other, let's say, where we see more effective driving forces. I wouldn't say that we have already the action that we need, for example, from climate change. So I wouldn't want to draw that parallel in that sense, as we are really behind as well what we need to do. But I think it's clear, at least from the areas of tackling other infectious diseases and climate change, that you need real international solidarity to materialize concretely. So with clear commitments, I think with AMR, we've in the past years, including in the high-level meetings, highlighted the need for more support for developing countries, including for infrastructure, as well as for mobilizing financing concretely. So I think where we're seeing a lot more concrete actions in other areas, this would be really helpful in AMR as well, in particular to mobilize financing towards AMR for developing countries.
Thank you. I want to bring all of our panelists back now and sort of stay on this question of positive examples. And so I'm going to go to Anand again next and just ask, do you have any other examples of positive progress that's being made or from other policy areas that you can kind of call attention to, and maybe bonus points if it helps kind of reach out to the SDGs that are outside of the health realm in some way and tackles those AMR sensitive questions?
Yeah, no, couple of thoughts. For me, it has been very, very helpful to see the collaboration not only among UN agencies, but also with other partners on the whole aspect of production and consumption, where in terms of reducing waste management, it has been really interesting for me to see their focus, for example, on reducing wastewater flows from healthcare centers. So that has a direct impact on AMR, spreading into the environment. And then further, problems, challenges. But how they are thinking of such wastewater treatment facilities and even small healthcare facilities, how they have to coordinate among various ministries and various agencies to address that problem. For me, that was interesting. That okay, here's someone doing a lot of work that benefits the AMR response. Similarly, in the control of waste from pharmaceutical production plants, that also is a critical area, and it's much broader than AMR, of course. But the fact that there are, folks from the environmental movement and water and sanitation teams and health teams, and also the ministries of trade in many countries, all engaged in controlling and regulating and trying to address that. For me, it's a good example of what we could be doing to address some of these drivers of AMR. The other thought in terms of someone outside or some goal outside of the health goal, for example, reducing inequalities. I think one of the key indicators there is also about migration. And so you can see how someone like, folks, civil society organizations dealing with migrant populations, and then WHO with the Migrant Health Unit, etc., can really try to understand what is the impact on AMR and access to medicines and antibiotics, and how this is then linked to the other SDG goal on peace and security. We are seeing this as we talk in Ukraine. Soldiers with significant resistant infections being brought out and then moving on to Poland, etc. And we are seeing highly resistant strains moving out. So we can see how various goals are involved in actions that really have an impact on AMR as well. So for me, these are all positive things. I keep picking up all these stories, and my head is buzzing most of the time. But I can see how people are all doing their work. It need not be AMRs labeled AMR, but they're all doing their work, which will have an impact on us. Yeah.
Thank you. And Sujith, I know ICARS has been ramping up a lot of on-the-ground projects on AMR at the moment. Do you have any positive examples you want to share from the work that you've been doing?
So thank you. Yes, ICARS, for some of you who may not know it, of course, we actually look at the priority and needs in the countries and then start working with the governments, research institutes, and those on the ground to look at contextual solutions which have a implementation and intervention angle to it, so that we really see what are the challenges to implement it, but also try and create these models. So if you look at from an SDG point of view, in some of the, of course, our website describes all these projects in greater detail, but just a snapshot. For example, no hunger, SDG 2, and then you have 8, 12, and 15. It's all about food producing, animal and food security. And you can see this in the Tanzania project, which we've done to develop and test a business model for sustainable vaccination and biosecurity interventions in the commercial poultry sector. And the reason why it's so important, not just from a hunger point of view, but also from an economics point of view, is that they are getting more and more dependent on the poultry, and from a protein point of view. So a side on, of course, is to reduce antimicrobial use, but also support farm collaborative training from a sustainability point of view. Another example in the human health and SDG 3 is in Kyrgyzstan, actually, where one of the biggest problems has been because of the lack of laboratory facilities at the primary healthcare level. Many of the children with respiratory infections are given antibiotics. And so we've developed a clinical trial, actually, to determine the effectiveness of point-of-care tests. And we've actually seen a great reduction in antimicrobial use. And this has been actually adopted, is being adopted into the national scheme of things. So that's an important thing from a implementation and economics component. Then you have gender issues with SDG 5. And we have a project, actually, which this is slightly different, but we look at the interconnections between AMR and gender by synthesizing the current evidence based on AMR, gender, and other overlapping social behavioral characteristics, purely to kind of prioritize the knowledge gaps there and then use it beyond. If you look at SDG 6, clean water and sanitation, one of our JPIMR projects in Vietnam is, I think, a good example, where we look at the overall aim to reduce and evaluate transmission of CRE from discharged patients to both household members, community, but also the One Health sectors, livestock and environment, through a bundle of interventions. And last but not least, I think the last two I would say is SDG 9, where in terms of innovation, we're looking at two projects in Colombia, actually, where one of them is about the weaning piglets, actually, where there's been a lot of diarrhea and therefore antimicrobial use. And we've had a survey on colostrum and vaccine protocols and antibiotic practices, and we found a lot of use of antibiotics. So we're trying to assess the effect of an improved cholesterol protocol and vaccine protocol. But I think in all this, the issue really is that we need partnership. And one of the greatest partnerships we have currently is with React Africa, where we are trying to ensure that we advance the national action plans with the quadripartite research agenda, including the responsive dialogues with Welcome. And I think this is very important because really, if we can inbuild these SDGs into our discussions on NAPS, I think both will energize each other. And so these are kind of the positive examples I can see. But of course, the website will tell you much more. Thank you.
Thank you. And you're teeing up my next question perfectly about integrating the SDGs into national action plans. Anand, I'm hoping you can tell us a little bit more about WHO's new people-centered approach to AMR and how the SDGs come into the implementation of those activities that are within the people-centered framework.
Yeah, thanks. Thanks, Susan. So yes, we are trying to move away from working on AMR as a drug bug problem. And we are looking at it from a people-centered approach and trying to understand, what are the barriers and challenges people face, prior to getting an infection, and then when they have an infection, what happens? But also looking at the health system gaps that have a huge impact on people's, healthcare. So we developed a sort of a AMR people journey that is really focused on four critical areas. One is access to prevention. And so that includes infection prevention and control in the in healthcare facilities, but also in the community, clean water, sanitation in the community. And another good indicator is access to basic immunization for children. These are very critical prevention measures. So access to prevention. The next stage is access. So if someone does get an infection, do they have access to basic, the essential package of health? Essential health services. Is it accessible to them? Is it affordable? Is it available? And what is the financial implications? I think the SDG data clearly shows around 390 million people have been pushed into extreme poverty because of out-of-pocket expenditure for health. So we access to health services, basic health services, is very, very critical. So then, once they come to the health services, do they have access to basic diagnosis and the supply chain and the reagents and the basic tests that are required to identify a resistant infection? So this again has been a major challenge and a huge gap in the Global Action Plan itself. This has been a huge gap within the Global Action Plan. And once it's diagnosed as a resistant infection, do they then have access to affordable treatment, quality assured treatment? So that is like the AMR people journey. And based on this, we have created a core package of interventions. And that include these four pillars. Sujith was part of it, in fact. So thank you, Sujith, and about, I don't know how many countries and civil society members. And I think even you, Susan, have provided input into this framework. So it's been very well received. And in terms of the SDG elements, so we have these four pillars of prevention, access to health services, access to diagnosis, access to treatment. And then we have some foundational elements that are critical. One is on governance, which is also part of coordination. And one is on education. So that's also very, very critical. And research and innovation, not only for the richest countries, but for low and middle income countries. And of course, then you have IT and surveillance and information as the foundations. So there are many aspects of the SDGs, including many indicators within the human health area that are critical. Reducing inequalities is critical. Reducing hunger, because stunting is a huge problem. Children who are malnourished are prone to various infections. Reducing inequalities in terms of key vulnerable populations, including my unit is working on gender equity and disability inclusion in national action plans, so that national action plans are really people-centered. And within this whole approach, we want to provide a significant role for civil society and the community. Otherwise, it's not a people-centered approach. So we are really changing the, completely shifting how WHO was looking at the problem from a more microbiology and pathogen approach to a people's problem, and how do we address this problem, and address this problem jointly with other sectors, other ministries, in collaboration with civil society and the community. And so this document will be ready next month, and it's going to really provide the key strategic and operational framework for the human health sector moving forward. So we are making a big shift in how we are going to address AMR, and we need more partners. And so, feel free to join us once this document is launched. There will be many opportunities to provide support at the country level, at the regional level, at the global level. Thank you.
Thanks, Anand. I think this shift towards a more equity and people-centered approach will be very, very helpful for AMR. Viviana, I know the South Center recently published a paper that highlighted the challenges that least developed countries are facing in achieving the Sustainable Development Goals, and also about the importance of international collaboration to support least developed countries. How do you see those kinds of challenges playing out for AMR, and what kinds of support do you feel that low and middle income countries need to both act on AMR and to achieve the Sustainable Development Goals?
Yeah, so least developed countries, they carry about 14% of the global population, but they provide less than 1.3 of GDP. So that really shows how far behind, at least on economic terms, LDCs are. But we're talking of millions of people that are living in the more difficult conditions and are more prone to any crisis. So one of the issues is really we have enormous financial gaps for the Sustainable Development Goals. Many commitments that simply have not been, we haven't seen them being really extended. And as we heard in the last 2 days in the UNGA, well, there's renewal of commitments, but we don't see any new additional funding coming in. So given the reliance on external finance by LDCs, I mean, this is a key area where we really need to support LDCs, in particular, an increase of overseas development assistance. So in the SDGs, there is a target of 0.7% of gross national income target for developed countries to provide developing countries in terms of ODA. Now, right now, there is an overall downward trend of ODA that goes to least developed countries in particular. So it's very concerning that only about 0.06% of current ODA levels go to LDCs. And the commitment was to allocate at least 0.15 to 0.20% of ODA to LDCs. So that, I would say, is that the first critical intervention is to say we really need to raise the ODA that goes to LDCs, given their particular vulnerabilities and their reliance on external financing. And in ODA, you may know, of course, that it's been rising, but that proportion is to in-donor refugee costs. So we really need to turn the tide for LDCs on support for financing. The second one is, again, to say, well, why do they need this external financing? Is also because they have extremely high levels of debt. So that overall is another issue. How can we find ways to address this systemic weakness of LDCs, in particular with much more better terms for debt reduction or debt elimination? Another issue would be we really should have a package of emergency measures for LDCs in times of crisis. As we saw post-COVID, they were the most hit, and there is no actual, direct response particular for LDCs so far, and we need to put that into the system for our next crisis. Then just moving very, very rapidly to the AMR and the national action plans for LDCs. Clearly, these are underdeveloped and they're very underfunded. So where can we focus priorities for LDCs and national action plans? I think as Anand and Sujith have said, we should focus on preventing infection and reducing unnecessary use of antimicrobials. So focus attention on how AMR is emerging and how it spreads. And in looking at these contexts, the priority should be that transmission of infections. How do we address the hunger and nutrition gap? The higher burden of infections leads to the increased demands for antimicrobials. So improving access to quality healthcare services and veterinary services. So these are really the basics, but it's really what we need in these contexts. And improving the access to medicines, vaccines, and diagnostics. Without this, as well as to the lack of antimicrobials in themselves. Already it was mentioned, but it's so important that we focus on the SDG on clean water and sanitation and hygiene. I mean, these are massive infrastructure costs that really we need to get the community on board to support and to then highlight the link of improving wash, in humans and also for animals, and how this overall helps prevent infections worldwide, which at the same time is a bonus. It's a win-win for everyone. It's not only international solidarity and purely on terms of assisting other populations, but it will help reduce the burden of AMR and overall infections around the world. And finally, on the environment, I think it was very well mentioned, but this is usually not touched so much in our discussions about how we should give more attention again to waste management. It seems something, not so interesting for some to look at, but we really could help so much of infection prevention with better waste management from human waste and animal manure, just basic interventions that may be more low cost than other, for example, activities on surveillance, which are also necessary, but that perhaps in LDC context might not have such direct impact, or in terms of value for investment may have less returns as compared to these basic essential services that we need to provide.
Thank you. It strikes me that with a lot of the sustainable development goals, investments in those key initiatives like clean water and roads and electricity in hospitals and things like that, you're already going to get so much AMR benefit just from acting on those SDG activities already. I want to go now to questions that we're getting from the Q&A. So if folks haven't gotten their questions into the Q&A box yet, now's your chance. And we can bring back all of our panelists and go through each of these, I think, together. So the first question that we have here is about AMR as a super wicked problem that can't be solved with these sorts of linear and siloed approaches. And the question is, how much of this complexity in the AMR space has really been fully embraced by the international community? To what extent do people understand how integral AMR is in all of these SDG questions, and how important it is to focus on all of these interlinkages between AMR and hunger and health and development and all of these other things? Maybe I'll go to Sujith for his response first, and then others can jump in afterwards.
Yeah, thank you. I mean, as I mentioned about the building, it is important to give an analogy. Otherwise, it can be so complex. And people, I mean, if you see a person or you're at an event, everyone perceives one part of it. Now we have 5 to 6 senses, and people sometimes use eye or the vision more than let's say smell, for example. And this is so classic of AMR, where it's not just about the bacteria versus person issue, but it's the microbiome and the complexities of the microbiome in its relationship to the environment beyond the planetary part of it. That interface is really at friction. So if you look at it from a complexity point of view, it is important to break it down, but at the same time, it is important to be holistic. And this is the challenge of clear messaging, actually, where do we start? Where do we finish? But also, how do we bring in these angles without it getting too complex? And that is why that analogy becomes very important. Of course, I just took one analogy, but we need to have a particular analogy which is catered towards these targeted populations. So if it's public, make it a simple one. If it's policymakers, something which they can understand. If it's healthcare professionals, something they can understand. Last but not the least, I think we need to recognize that there is an interdependence of human, animal, and environmental health. And if that basic aspect gets implied in whatever we say, plus the fact that we need to have this holistic thinking, this transdisciplinary communication as well as work, and last but not the least, this collaborative thing. These are the 4 elements which will move towards simplifying the issue and forward movement. If you don't get these 4 basic pillars right, then whatever we do with all our silos, etc., sort of collapse, and it becomes another brick in the wall. Thank you.
Thank you. Viviana, same question to you, but I'm also curious about your thoughts on how we explain the complexity of AMR to folks who are not within this AMR silo, who aren't even maybe within the health silo and aren't used to thinking about the challenge in this way.
Well, I think Sujith put it very well. First, that you really need to see who's the target audience. It's not the same to talk to the healthcare professional or someone who is a veterinarian, that if you're talking to a policymaker who is dealing with more overall issues and thinking more in terms of all the priorities, even in the health area, and then trying to then understand, well, why should AMR, for example, take off some resources potentially from another area to come into AMR? Or if we're talking about the importance of surveillance, and the questions might be, well, where are we going to get the particular infrastructure? We already have laboratory capacities very strained. So I think that issue about really targeting the messages towards the right audience. And then also, I think, is engaging in a discussion on understanding where are they coming from in terms of what are the problems that they are highlighting, to then explain how AMR actions could be part of the solution to those broader issues. So for example, when we talk about the high burden of infection, that might be an entry point to say, well, here AMR is also, some of these interventions have to do with this broader issue you are dealing with, or with basic veterinary services, how we can bring AMR interventions to improve overall that work that veterinarians are doing, and how to help bring more resources into that area through AMR. So I think that is a good way, as Sujith put it, to let's not only focus on making sure that our message is clear enough, or let's say when it's not a technical audience, not so technical, or the other way around, but really invest in understanding what are the problems that those that you're talking to are really facing as their priorities, and then try to bring in the AMR discussion through that explanation, that relationship with those related issues, in particular, as we see that there's so much complementarity or synergies in between what can be done in these areas.
Thank you. Anand, I think the last word on this question to you, but we have a couple of WHO specific questions I'm going to throw in as well. One question is asking how countries can access WHO support in terms of dealing with these types of challenges. And the second question is about the inclusion of other aspects of One Health within the people-centered framework and things like that. So maybe alongside all of this, you can also talk a little bit more about what the quadripartite is doing.
Yeah. So first, yes, it is a very, very complex problem. And as Sujith rightly said, I think we have been making a mistake, I would say, in the past maybe 10 years of analyzing it in a much more scientific way that goes over people's heads. In fact, a government official asked me, it was after the World Health Assembly, AMR is in the water, it's in the food, it's in the air, it's in animals, it's in crops, it's on my playground, everywhere. Kids get infected, old people get infected, the whole life cycle people get infected. So he said, and you're saying it's a natural phenomenon. So do we just have to live with this? And so it was a smart question from a policymaker who has read enough to know that yes, it's a complex problem, but it is stuck. He does not know where to start. And so my first question was, have you looked at your national action plan? What does your Ministry of Agriculture want to do there? What does the Ministry of Water Supply need to do? So I think we need to break it down. Okay, there are some system fixes that need to be highlighted. At least I'm talking about the policy level here. There are some system fixes that need to be highlighted, like clean water, waste management, cleaner, better procurement, good regulations. It's really important. So these are system fixes. And maybe we should even talk to those financing development to have some sort of an AMR indicator in any grant and any loan in IDA projects. Why not they consider some sort of an AMR indicator that triggers that, okay, what you're doing is good, you're building systems, but it's having an impact on AMR. I think that something like that would be helpful. In terms of changes, in terms of addressing the complexity, I think we also need education and awareness, to bring about some behavior change. that's the other side of the coin. We need to also recognize it's a problem in our own context, in our own understanding of science, and what is the natural phenomena, and then react to it in a way that is addressing AMR. And here I am now looking at the next generation. I think they are our saviors. So it's a 30-year problem. I don't think we will have very good solutions until 2050. But for me, it's the younger generation and the youth who need to start thinking of AMR like they are thinking. My daughters, who you saw before the webinar, are reading about climate change. So if at their age, at 6 and 9, they're reading about climate change, we need to start educating the youth at this point to start thinking about AMR as a global problem, and maybe access to effective antimicrobials as a global public good. It must be seen as a effectiveness of antibiotics. It's a global public good. We will all suffer if antimicrobials become less effective. So for me, I would look at it as a systems approach and then a behavior change communication approach. And if countries want solutions, of course, they can always reach out to the WHO country office. We are equally impacted by the financing problem. We don't have AMR experts in every country. There are people wearing 4 or 5 hats doing different things. So this is why we are focusing on integration of AMR into the health systems work, and also integrating AMR into the whole health emergency and pandemic preparedness and response. We don't see AMR surviving as a silo. It is impossible. We don't have the resources. We need to embed AMR interventions, our core 13 interventions, into these systems. This itself is a challenge because they don't seem to recognize AMR is also their business. And this takes a lot of, I think, negotiation, but also education within our own health sector. And I think this is also true in the animal health sector and agricultural sector. We need internal coordination and then multi-sectoral coordination and education. And the quadripartite has come together and created the joint secretariat that has a work plan, and is really trying to see how each sector could be strengthened, because there's always the complaint human health has more resources compared to animal health. It's proof, in most countries that is true, agriculture, etc. So we need each sector to be strengthened in its ability to attack AMR, but we have to then bring the data, bring the analysis, and then figure out, okay, are we making a difference in the burden of AMR in the country in a multi-sectoral coordination mechanism? And this itself is a challenge, but I think this is what is needed. We can't all say we're all doing everything together. It's a recipe for disaster in my experience. Might not be true for others. In my experience, I've seen paralysis even in rich countries because of this problem. But each sector should be well-resourced to focus on their particular areas, but then someone is looking at it, coming together and looking at it in a holistic way. As Sujith said, planetary health, from that concept. But it also needs, again, our own governments and member states to take a step up in their thinking. These are problems that cannot be solved by one sector alone. We need to strengthen everyone, train everyone, resource everyone, but the problem needs to be solved jointly. Yeah.
It's a very big project. I want to go now to our last question, and I'm going to move the timeline a bit, not to 2050, as Anand said, but just to 2030. I'm wondering, how can we use the SDGs and the machinery that has been built up around the SDGs to measure and make progress on all of these AMR challenges that we've been outlining around antibiotic access and financing and One Health issues? And how can we use that to create action both for AMR and for the SDGs with the limited amount of time we have left in the Sustainable Development Goal timeline? Viviana, I'm going to go to you first.
Yeah, so first I would highlight again that if we do have progress on the SDGs, we will have progress on AMR. And that would be a first general point to make, is how do we actually create more linkages between showing that progress, for example, on sanitation, on access to clean water, on reducing infection, that has an impact on AMR. Right now, the SDG framework only has 2 particular AMR indicators that were introduced in 2020, and these were, very human health centered, and they're about, particular proportion of bloodstream infections for specific in the specific areas. Now, I won't go into the detail. You can look at that. But if you see, there has been barely any reporting by countries on these AMR indicators under SDG 3 on the target 3D. But it was a good idea to say we really want to introduce some targets specific on AMR as part of the SDGs. I think we can build on that to develop that in other sectors and in other SDGs. And that not necessarily that countries will be reporting on all of those targets, but we as a community of those concerned with AMR can do that and have more transparency about what is being reported specifically if we have these additional indicators in AMR as part of SDGs. I think the other issue would be, again, this deeper understanding that we here are very clear on about integrating SDGs as part of national development strategies, because there's a broader issue as well about SDGs are not necessarily well known or let's say, well induced at country level. Not only between policymakers, but overall practitioners. If you talk to them of what's the SDGs, they might just say, well, something in UN over there, but not something really that is part of their plans and their actions. So even bringing down the SDGs into broader national development strategies and then through the different sectors to have a more clear linkage. And last, I'd like, maybe not last, one additional point would be just highlight again the issues about financing, and because several questions came up on this. I think one of the areas is reducing the debt burden of developing countries, which is not just about creating new resources from developed countries to developing countries, but actually finding ways to just reduce the existing debt that is making it very difficult for developing countries to actually provide domestic resources into AMR and other health areas. The second one being raising ODA, as I mentioned in the case of LDCs, but we do also need this for broader developing countries. And now on the last point I wanted to make on this link with SDGs is really the more holistic approach, which is drawing lessons again for COVID-19 and the potential of what's being built for pandemic preparedness and response. But if we look at what happened, for example, with the pandemic fund that was established outside WHO, World Bank managing, if you see the projects that have been selected, most of them are going towards areas of surveillance. And so we need still more of this financing to go to this basic and costly issues of infrastructure and basic capacities. And there is where I think we need to create a separate fund. I don't think it's enough to say, well, we have the pandemic fund. So for the UN high-level meeting on AMR, I think the focus should be, again, about drawing 2016 commitments back into now to some more specific commitments, but not just to say, what's the amount of financing, but really where should be the priorities. And I think that really should be also context specific, because a lot of the donor-driven funding at the moment might be in areas that are not necessarily the priorities for some of the particular country recipients. And so that needs to be also, managed adequately so that there is some really, inbuilt or taking that agenda as being the agenda that's led by the country and not where, the finance is coming from.
It's so important to have that agenda led by countries directly. I know we are running short on time, but Anand, last words from you on using the architecture of the SDGs to help mobilize action on AMR.
Sure. Very, very quick point. Every country has a UN Sustainable Development Cooperation Framework. So all the UN agencies come together and discuss with the government what are the SDG priorities that they want to work on, and then provide technical support and financing support, or supporting the access to financing. So AMR needs to be part of this, and it has not been part of this. So in many instances, it has not been part of this. So I think an immediate step would be to make sure that these cooperation frameworks and the national priorities include AMR, and dealing with food, agriculture, and animal health and human health, etc., water, sanitation. So it can all be covered. So that is one issue. The second point I would make very quickly is that even from the significant amount of funds as part of the COVID-19 response, I am aware that a lot of funds remain unspent. So why not reprogram those funds that are already in the countries, in low and middle income countries? It is sitting there. It has not been spent. We are talking about more than $1 billion sitting there at the moment in countries that could be reprogrammed to attack certain systemic problems like it need not be nationwide, but they could really focus and use that funds to strengthen various system aspects of water, sanitation in primary healthcare facilities, improving lab diagnostic systems, etc., or improving vaccination rates. That would be great. So there are some funds available, but have not been absorbed. I think we also need to look at that absorption capacity in countries. Yeah.
Thanks, Anand. Sujith, last word to you for the session today.
Thanks very much. I think the important thing is, if you look at it, to me, 5 things stand out. One is universal health care is going to be very important, especially because many people just don't have the money in their hands, out-of-pocket expenditure, etc. Second is system strengthening, both in healthcare as well as One Health sector. And if you don't do that, things just crumble apart. Third is communication and clear messaging, as we discussed earlier. If you don't do that, the cause is lost. We need to build the investment case in each SDG with AMR, in my opinion, and that will give the policymakers much more clarity on this link. And last but not the least, let us be preventive rather than curative as far as possible. If you look at every SDG, Anand was mentioning about education for youth, let's capture the young, let's be preventive. If we're talking about water or flooding, migration, let's make sure our systems are in place before the flooding happens, right? And then all the infections, and then all the antibiotic use. Even partnerships, what are we waiting for? Let's get together, right? I know we're getting together, but let's move forward with that getting together. So that's what I would say. But let me end with the last word. In my opinion, AMR is a test case for the world to see whether we're in the right frame of mind, whether we are deserve to be stewards on this earth with the right frameworks through the SDGs, the Global Action Plan, and all the efforts of the quadripartite. But also whether we have the appropriate framing of clear messages to all stakeholders, and I underline all. Moving towards planetary sustainability and the sustenance of living beings. So my challenge to everybody listening is we need to rise to this test as a society and civilization across One Health. Thank you.
Thank you so much. I like to end off a webinar with a challenge to everyone listening. I want to give a huge thanks to all of the panelists who've joined us today. This has been a fantastic conversation. And I know that there are other AMR and SDG events that will be happening this week. So please do check the links that are in the chat for other interesting webinars that you can participate in this week. We have recorded this webinar as well, and it's going to go up online shortly. So please do share it with friends who would be interested in hearing about this as well. And please also just join me once again in thanking our panelists for today.
Thank you.
Thanks so much, everyone.
Thank you for the opportunity.
Thank you, Susan, and thanks to the Global Strategy Lab and the AMR Policy Accelerator for your excellent work. We as WHO really benefit from your collaboration. So thank you very much.
Thank you.
Absolutely. And thank you for organizing this great initiative. And let's hope we can partner much more. Thank you.
Absolutely.
Thanks to the others also. Viviana, Anand, thank you.
Thanks, Viviana. Hopefully we'll meet.
One is here in the UNGA.
No, I'm not there this year. Maybe next year.